Uh, Thank you, Chairman Tester. I just have a few questions. Ms. Elam, in your response to Senator Cassidy's question related to the suicides that occur in the first 6 months, I'm wondering if eVest, the bill that passed the House with 44 Republicans voting in favor of it, might also be relevant to addressing the suicides that occur within the first 6 months of separation.
Yes, I think that it could definitely be, have a positive impact. So, definitely be able to, we've offered our support for that.
Yeah, and so, of course, eVest is an opt-out provision, which instead of having veterans having to opt in by enrolling, we automatically enroll them. And we capture quite a number of veterans who ordinarily would not have been enrolled in VA. And of course, we know that the more connected that veterans are to VA, the less likely they are to die by suicide. Commander, in your testimony, you note the years of data showing that community mental health providers are not as well trained as VA providers to treat veterans with PTSD, suicidality, histories of sexual assault, and traumatic brain injury. You make a compelling case for legislation I'm trying to advance to mandate free online training in evidence-based treatments for VA's community mental health providers. Can you tell my colleagues here today why it is so vital that we require Mission Act network providers to be better trained? I mean, the mental health providers.
Thank you for that question. Years ago, veterans were discharged. They had the VA for mental health care, but the VA nor the public was equipped for post-traumatic stress disorder treatment until the vet centers were established, and the DAV was the main driving force behind that establishment of the vet centers. And we even had our service officers travel around the country and provide training not only to VA but the public on PTSD. And I will let Ms. Elam provide further details.
An excellent point, and so critical. Every veteran should be able to expect the same quality of care if they have to go to the community to get it. We know VA has the expertise. They're the main provider we want them to see, especially if they have PTSD. But in cases where they do go to the community, having that training is so important. We do need to, I think, work with VA to figure out how, that is extensive training that VA does. They're, for evidence-based treatments, there's a mentoring phase, there's a lot to, that goes along with that. But it's a great idea, and I think we should work towards that. That's what you want to see, that network tightly linked to VA.
Well, thank you, Ms. Elam. And let me just add that I recall several years ago, VA making a very important correction in terms of how it dealt with opioids after having had several terrible incidents around the country. And they implemented this, a much more stringent prescription policy among its own providers. Unfortunately, the administrative policies that they set within VHA did not extend to the community care network. And so the opioid sorts of restrictions and rules and regulations that our own VA providers were obligated to observe did not extend to the community care providers. So it's not just training, but it's also the type of guidelines that and actual policies that our internal providers have to follow. I believe that we need to find ways in which those policies extend out to our community care providers